right, I think we're going to start, and we'll just let people catch up. The other thing is that, are you recording it now? Okay. So the good thing is this session is being recorded. My name is Mark Richey. I'm here to speak to you about the first mile. I'm from Kofax, a company down in Irvine that's been doing this and perfecting this for 30 years. Some of the things you're going to see, don't feel bad. You go, we don't do that, because probably 12 years ago you couldn't have done it at all. 7 years ago you could have done a little bit of it, and you would have probably had to been within about the last 3 years to take advantage of some of the technology we're going to share with you today. But this is all about the first mile of contingent interaction. So here's the agenda. I'm going to define what the first mile means. We're going to go through and we're going to talk about some customers that have perfected that first mile, or at least got into the steps of doing that. We're going to have a video on Ventura County and what they've done, as well as Jerry Gray from Sacramento County is going to share where Sacramento County is in their journey through working with the citizens and the constituents on the first mile. And then we're going to talk about the art of the possible. So Ventura video is going to go through and say, here's what we've done. It's a 3-minute video, and they're going to cover a lot of stuff fairly quickly. Jerry is going to be able to be here in person to talk about their world, and you can ask some questions to Jerry. And then what we're going to do is we're going to roll into the art of the possible, meaning we've taken what Ventura has done, we've taken what Jerry's done, and said, by the way, here's the other fringe things that can make you even more successful. And then representing CDPH, Richard didn't know I was going to pick on him, but Richard is here, and he's using some of this technology too. So we definitely have some people we can talk to about this. First mile. So the definition of first mile is really systems of engagement. This is our constituents. This is how people want to deal with us. And they don't want a wrong door. They want to be able sometimes to carry in paper, sometimes to send in paper, send in electronic paper, faxes, emails. They want to be able to send in documents from their telephone. They want to deal with us the way they want to deal with us, right? They want the government to transform to how they want to be dealt with. And so this is the world, and they want us to be keeping up with all the commercial folks, right? The banking, how you do banking. They want like fast food. I drive through, they hand me my taco, I'm happy. So that's the left side, how people want to really work with us. And on the right side of the systems of record. System of record would be your ERP system, would be the fiscal system, would be a system in the back end that some system integrators probably come in and help design. Those systems, once they're designed, are pretty inflexible. You can't tell the systems on the right how to do things. The way they're designed is the way they're designed. So really the chasm in between is where many departments have a big gap. And that's what we're talking about. So the first mile is really how do we take the constituents on the left and then deal with them and help get their information in and their requests in on the right-hand side. And that's where we take that business critical process and we transform what they're asking for into those back office operations. So this is an example. So on the left-hand side, you see the paper coming through, and the understand and decide are people today. Somebody has to look at those documents and understand what they are, decide what to do with them, and put them somewhere. So that's where the first mile, that first part, that sometimes takes 80% of the time and 80% of the bottlenecks. What we're really talking about is taking those people, taking that down and putting the advanced technology there and letting the software go through and read the information and put that information in the right place. If we do that right, about 80% to 85% should be able to go through that process without having anyone look at it. You'll still run reports, make sure that you're accurate, but there's not somebody has to look at every single document and figure it out. So it's capturing the document, and you can see that there's a classify, meaning what are all these documents? What are these pages? So it identifies and classifies those documents, so somebody doesn't have to say birth certificate, driver's license, and bank statement. The next thing it's going to do is it's going to separate, because I don't want one bank statement running into a driver's license running into a different document. So I need to separate them, but I also need to separate mine from Jerry's, right, from Richard's, because we don't want our applications or whatever we've turned in to all mixed. So the system has to automatically be able to separate that. And then I may want to extract off of that. It may be that you're applying for human assistance and you sent in your bank statement and I need to pull off the information on the ending balance, and I have the ability to extract that. I also will have a step that validates. If the system doesn't feel like it's accurate enough and you set that, and it may be 80%, 85%, 90% accurate, if it isn't that accurate, what it'll do, the system will pop up and it'll show the end user exactly what the problem is. It says, I can't read Mark Richey's name, and it'll pop in where the name goes, it'll zoom in to my name, and now the caseworker will add that information. So a caseworker, instead of touching 100 out of 100 documents, they're going to go in and touch 80 out of 100 probably. So case studies, to talk about who's really doing this. Utah Child Support does 80,000, there's 80,000 people in that program, and so Mark Richey would fill out and put in an envelope a check, a form, and some court orders, some other correspondence. I think it says they have 246 different documents the system will automatically identify when they come in, so nobody has to say what that document is, it recognizes it. So it will read that check, it'll update it in the system. It'll say, by the way, Mark paid $700. Is he supposed to? Is that short pay, etc.? If it doesn't match up, they still deposit the check in the bank automatically with no human interaction, but it'll send off to a caseworker that says, Mark's not paying the right amount. Then the next thing that happens, the form gets scanned, and by the way, it could be any order. The form gets scanned, they match it up with a check. Is it both $700? Is it in the system $700? It recognizes all that. And it goes through. 96% of all the things that come in Utah Child Support that get scanned, after it leaves the scan operator's fingers, 96% time, everything is perfect, and it goes, and the check gets sent to the custodial parent automatically, 96% of the time. So that means that out of 100 documents, 96 of them are going without any labor, any oversight to have that happen. That's huge. The next group is Health and Human Services. If you think about all the paperwork that's coming in those organizations, it's a huge amount of constituents asking for services, asking for need. There's trailing documents. Most of the people don't walk in. If you have 10 documents, most of them don't walk in with all 10. They walk in with the 10 they think, and they might have left off a couple, had the wrong documents. So we're going to actually talk about that in our presentation, in our demonstration. Sacramento County's here to talk about theirs. Ventura County is going to be in the video. But CMS, that's ACA, that's the Obamacare. That's the largest document intake system in the world, right? And that's run by the same software we're going to be talking about today. Here local, CHP. If you're unlucky enough to get a citation in Sacramento County, your citation that you signed, and if you think about how poorly those things are written sometimes, those get scanned and presented with the information on that citation as well as the backup lookup of that citation to the judges when you go in to talk to the judge about that CHP citation. And Staples. Staples is not a government customer. All I do is government, but they were at one of my sessions in Denver. And Staples is pretty amazing because they process 3.5 million invoices a year. 2.6 of them are processed automatically without anybody having to touch it. And the secret is if it's within a nickel, they just pay it one way or the other. And they saved $1 million a year. So if you think about 35,000 vendors and they're scanning in all those invoices, it can identify who the person is. So it's Mark Richey Incorporated. It'll look me up in the database. It says, do you have a $117,000 order for Mark's company? Yes. Does it have 7 line items? Yes. Do they all add up to this? If it's yes, 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 they just pay it. And that is at least 74% of them come back from their providers correct in that sense. So there's not somebody has to look at that. So if you think about it, 74% of those people now can go do value add things rather than do keystroke aspects. So now we're going to share with you a video of Ventura. It's going to be 3 minutes, but it's talking about how they're doing all the intake piece and with their words. This one is a little bit salesy. They say Kofax all the time. We're going to try not to, we're trying to educate you today, but this is a pre-built video.
At the County of Ventura, over the last 3 years, we've seen a fair amount of change, both from a fiscal perspective and also in the way that we've delivered technology services. Kofax represented an opportunity for us to deliver a product that would add value to the business in fairly short order and meet the demands.
We've had a growing demand of services, a significant growth rate in the last 2 years, and budgets have been very flat, if not declining.
It's not likely that the Human Services Organization is going to be able to add resources during a recession, so they had to be able to do the same or more with the resources that they had.
So with Kofax and the concept of taking all that paperwork and putting it in an electronic format has changed our world. We deal with documents on upward of 15 to 20,000 documents a day.
Everybody's seen the Indiana Jones movie where they have this warehouse of all these crates. Well, we have something like that going on in government, and we have these warehouses with boxes of paper in them that look very similar. We're getting Kofax in place to capture the content off of these paper forms and get them into an electronic content management system.
The volume of paper was a real challenge. Being tied to a physical case folder did not allow us to have a distributed case management process. We were looking for a solution to automate that for ease of document retrieval and distribution of work.
With the Kofax solution, it was even more robust than I anticipated when we first explored this idea. So we've grown almost, in some programs, close to 200%, and yet we have not increased or doubled our staff. Now we're able to access information in a timely fashion to serve the clients that we serve.
The system is helping our clients tremendously. We moved to a task-based model where all the documents are being processed by several workers in several locations. So the clients can go to Simi Valley, drop off their paperwork, be scanned that same day, and a worker receive it in Oxnard and process it that same day.
With the introduction of Kofax, it really brings the Human Services Agency into the 21st century. You receive a phone call or the email and you handle it right then and there. One of my clients had turned in a quarterly report late, and by being able to just pull it up on Kofax, I saw everything that I needed.
It is so much different. It is such an efficient way of doing work now. The clients don't have to wait for their benefits because it was taking 2-3 days to get it to the worker. It could be anywhere from 2 days to 5 days, where now it's half a day to maximum 3 days depending on the workload. They are able to go into the system, extract the documents that they need, and within minutes process the documents, and the client would receive their benefits that same day that the documents were received.
Everybody has been able to provide a greater degree of customer service that is just paramount to our clients because our clients have a need. It's our responsibility to match the services that we provide to those needs.
Kofax has improved the integrity of the cases that we have tremendously.
Kofax improved our ability to serve the citizens and the clients that we interface with, most definitely.
Again, sorry for the sales pitch on that, but that's the idea of what Ventura County is doing. And what I'd like to do now is introduce Jerry Gray from Sacramento County, and he's going to share about their system.
Hi, I'm Jerry. I'm an IT manager with Sacramento County, and my primary responsibility is running the software that we're talking about today. I have a team of 10 people, administrators, business analysts, and developers that help bring this to life. So just a little background here. I've talked to people about this sometimes, and they don't really realize the size of Sacramento County, and that the county has a population greater than several states in the United States. And geographically, we're three quarters of the size of the smallest state, and we include numerous cities within our jurisdiction. So our DHA office services a very large population. They have 400,000 approximately active cases at any point in time, and they have a lot of programs that they service. Some of them listed here deal with getting food to people, getting people into jobs, taking care of our veterans. And they have 2,000 people approximately to handle that huge caseload. So much like you saw in the video, Sacramento was a paper-based process. We had a huge 80,000 square foot warehouse of paper that we stored stuff in, and every person's cube, if you saw it before we got into imaging, was just packed with case files on the desks and the overhead bins, even stacking up on the floors, paper everywhere. They wanted to be able to service people better, and the paper was really holding them down. Additionally, as you all know, we went through some bad economic times. So bad times means more business for DHA, but they're not about to get any more staff. That's just not in the cards. So the DHA leadership said, how can we do this better? And they decided they wanted to go to a service center model, and they wanted to scan all these case files, this big 80,000 square foot warehouse, all the stuff in the cubes. So they implemented a mailroom model where all the paper would go to a mailroom, and then they had a process going to get all the paper out of the warehouse. And that worked well. It got them into a service center model. Things were happening better than they ever had before. Everyone was happy. Some of the problems, though, is in the rush to get things into the system, they kind of cut some corners, and they didn't say that this form is this form. They kind of said, oh, these forms are kind of the same. So they said they're all in a category. So we'll just slam them all together. So when you go in and say, I want form 1, 2, 3, 4, well, it's in this category, and you look at the case, and there's 2 or 3 categories there, and you kind of find it. So much better than waiting for a file to come from the warehouse, but can it be better? And that's where we started looking into advanced capture, automated software to be able to go in and put it into the machine and have the machine figure out this is a form 1, 2, 3, 4 and classify it as such and put it in the system as such, so the caseworker can say, I need form number 1, 2, 3, 4, and there it is. So we got into that, but we went in with this idea of low-hanging fruit. So we picked our forms that we get most often, and we put those into the system through advanced capture, but the other stuff was still kind of the old way. So they said there's got to be a better way, and yeah, there is. Get all your forms through advanced capture. So we're currently doing that right now. We've got a vendor that's helping us to get the majority of all the DHA forms to be going through this pipeline to be automatically classified. They're wanting to move the scanning to the intake, so that mailroom is going to move out to the caseworker staff. So when I'm dealing with you to get you qualified for benefits, I'm getting your paperwork, I'm putting it into the system, everything is happening right there, and hopefully by the time you leave, the process is done or really far in the process. Some of the advantages we're hoping to get out of this is once we have everything properly classified, DHA has a system in place where they can start firing off tasks associated with different requests. So we're going to be able to automate that. When a form 1, 2, 3, 4 comes in, that'll fire off a message to a group of caseworkers that says, hey, you've got work to do, hop right on it. Additionally, data extraction. DHA has a lot of systems that they deal with, in-house systems that supplement what we have, and being able to identify that form, pull data off, and push into another system is going to be another great time saver for the staff. So some of our lessons learned, pick a proven solution. I didn't really go into this yet, but we did try a different vendor before going with Kofax, and while they had miraculous marketing, the implementation was lacking. So definitely do your homework when you're picking your vendor. Pick a vendor that you can trust. I'm a guy that likes to do things in-house. If you say, can you do this? I say, yes, I can do this. And I have the people, and I have a great team, and we're going to make it happen. And with advanced capture, we have made things happen. But I still have a small team, and advanced capture can be complicated. So we found that as we've gone to roll this out to the thousands of forms that DHA had, having a vendor that can bring more bodies to get a faster turnaround has been a very good way to go. And lastly, go for it. We did the low-hanging fruit when we went into advanced capture because we're kind of tentative. It was like, is this going to work? Should we be doing this? And the answer is yes, it works. Yes, we should be doing it. And yes, we should just put all the forms in on day one. But we're getting there. And with that, I'll turn it over to Jeff.
Thank you, Jerry. Any questions for Jerry?
Yeah, I have a question. I'm just wondering why you are not just using electronic forms, like when you do a real estate transaction, everything is signed on the fly, and so you don't have to deal with paperwork and you don't have to scan anything?
Yes, that is a very good question. Why are we just fully electronic from the start? That has been a discussion at DHA, and we haven't quite got there yet. There's a combination of county level forms that we have more flexibility with what we do with it. We also have a lot of state level forms, and DHA really hasn't come to a good solution on electronic signatures. So we've still got some barriers to address before we can go to a full electronic system like that.
Yeah, and you'll find that when you need to turn in your birth certificate, your driver's license, a rent receipt, those things are not forms that the state generated. So in many cases, we will have a mix. We'll have some forms that are state generated, which you have electronic and you can send out, you can get back, they might have a barcode on them, you can do some advanced things. But really, in many of our customers, it is that all the other documents, they really can't get in electronic form. Now, if they want to scan them and do that up front, that just helps the process. So if you remember on the left side, it said you can accept those forms from portals and all that. That's what Jeff is going to get into just now, is how do you take it from where Ventura went, Jerry went, and then what's the art of the possible? Any other questions for Jerry? Thank you, Jerry.
Thank you.
Okay. Does that make sense, everything that Mark's been talking about and what Jerry's doing? Do you guys as agencies process paper today? Are you having to do that? I know Richard is right here, right? Okay, so I'm going to talk a little bit about, I want you to give you a couple additional to add to what these two guys were already talking about, give you some other things to think about. And then I'm going to try to show you a live demo of something to show you some things in action and what's possible and what a lot of our agencies are doing, okay? If you look at this in the terms of a citizen submit some sort of request. I mean, this could be Health and Human Services organization where they're submitting an application. It could be they're submitting a claim. Whatever it might be, it doesn't matter. The citizen is submitting something to you. And that's where the start is. It comes in, and it could come in as a piece of paper. It could come in as an electronic document. It doesn't matter how it comes in. The end goal is that I've processed it all, and I'm ready to deliver on what the application is requesting. But when you think about that, there's a lot of steps that you have to consider when I get from that start point to that end point. For example, application comes in, where is it coming from? Okay, I have to be able to input it from where it's coming from. If it's a piece of paper, I have to scan it. If it's coming from an email inbox, I have to get it off of that server. If it's coming from my portal, I have to get it off of there. And then I have to classify it. I have to decide, what is this? Is this an application? Is it a driver's license? What is it? And then I have to take data and enter that data into a system somewhere. I have to say, here's an image, and this is a driver's license. And I have to make decisions on what the next step is, right? What if there's missing information? What do? What if on the application they didn't fill out a certain field? What do I do? How do I manage that process, right? How do I validate that the data they're putting on there is accurate? How do I collect a signature from them? You know, is it part of my agency's legal requirements that I have to have a signature? And so then I has to come in as paper. Signatures are one way of why you still have to have papers, because you legally have to have a signature. How do I communicate back and forth to that citizen, right? How do I correspond with them? How do I generate a letter? How do I tell them that we're missing some information? And then again, I have to put that data somewhere. Then I have to manage my exception processing. What if it comes in and there's a certain piece of information that follows a certain path, and so it goes through an exception path? Who processes that? How do I update my systems? How do I have rules? And how do I maintain visibility on all of this stuff? So you think about, all we're talking about is, I'm not even talking about delivering on the application yet, delivering on the services. I'm talking about just getting the information to a point where now I can deliver, okay? So that's what we're talking about. So I'm going to try to show you here a live demo, and let's see how this works for us. So this is kind of the art of the possible here of, all right, we lost my connection to my system here. All right, can you guys see that okay? All right, so the idea of this is, come back to me. There we go. Is all those things that I was just talking about, what's possible? How do I interact with this customer? Okay, so I'm going to walk you through a scenario where a citizen is actually going to a portal and potentially applying for services. So this might be a way to actually get to a point where I'm not accepting paper documents, I'm doing it all electronic. So the citizen can come in, and this is just walks through a sample scenario where they're applying for some services. Okay, so we're going to go apply for some new services. Program A is what we want, and the system's going to walk them through the ability to actually capture some information. So it walks them through, okay, we need a copy of your pay stub. So then click here, and there's several ways to do this, and I'm going to show you two of them. One of them is just simply attach a pay stub that they might have on their machine. They hit complete. Now, all this advanced capture stuff we're talking about, how about you, when they attach that pay stub, how about providing them real ability that we wanted a pay stub, but they actually attached something else? The software is actually looking at the image itself that's being attached and validating that it is a pay stub. And if it's not, provide that real-time feedback back to the citizen saying, that's not a pay stub. They can also attach things like a proof of address here. So you can see they've now attached that one. So proof of address, again, they can attach that. So this might represent a proof of address right here. So let's submit that in there. And again, we're actually doing some real-time looking at that image. Is that a proof of address or not? And if it's not, do that. So before I'm even getting to my system record, I'm managing that whole process. Now, I'm purposely not going to attach a photo ID because I'm going to show you a method to attach that. So then you can walk the citizen through all the rest of the collection of the information as part of that application. So you'll notice that now the form has already started to get filled out. First, last name, and the address. This is all data that we've extracted off of the information they've already submitted. So when they submitted their proof of, or their pay stub, that's all information that we extracted from the pay stub. Okay, so the user doesn't even have to fill this out. We've extracted that automatically from that image. Okay? So they can change it if need be. You're helping that citizen validate all this. We also, in some cases, may want to collect some other information. Let's get my system connected here. There we go. Okay, so now we're also extracting any information. So again, we've already populated what their pay is here because we extracted that from the pay stub. So they can validate that information, add any other additional information. These are dynamic forms where the total monthly income gets updated automatically and so forth. So we continue through the process. This is just a sample example of how I can walk them through collecting all this information. Now this forms you're seeing here can also be accessed on the phone, on their phone. So it can be a mobile interface as well. So they don't if they don't have a computer, but I do have a phone, they can do it from there as well. So again, we're asking for any expense information. Now, the next thing we're going to collect is an actual signature. Okay, so this is where if for legal reasons on my application I have to have a signature from that citizen, I can actually collect an electronic signature. So you guys have seen, you know, if you've ever done a mortgage and you collected electronic signature, that's what we're talking about, is the ability to do that. So that citizen can click right here. They can do it from the computer, they can do it from their phone. And it's going to render an actual document with the information that we've extracted and the information they filled out in the form, and they can now sign this. In this case, I'm doing what's called a click to sign. So they can actually put a signature on here with their mouse to capture that signature. Okay, so I've now captured a legally binding electronic signature as part of the application, and it will come in the audit trail of the signature and then the actual image of the signature. Okay, now you remember at the beginning how we did not put a driver's license in, right? So the application's been submitted, but we haven't taken any of this information to the system of record yet. We're still managing that upfront process, but they're missing a document, right? So we actually send, and I'm going to show you my phone here. Okay, you guys see that okay? Good. So the user can go into their email here, and you notice an email just came in here saying, John, thank you for applying for the government program. This email is to confirm we received your application. While most of your supporting documents have been attached, you're missing your driver's license. Okay, so he gets an email on his phone that, hey, we still need a document. No one has, the system is managing that, what documents have been missing. No one had to actually go in and manually determine that we're missing a document. So that citizen can follow this link right there and actually capture their driver's license from their phone. This becomes a part of that. So I have a driver's license right here that we're going to capture. So they're taken to either an HTML page, whatever it might be, just the ability where the technology can take over the phone and look at the camera and actually take a picture. So that user, all they have to do is hold that over the document or the driver's license, in this case a driver's license. When it gets a good image, it will actually snap the picture automatically. So I want you to see what happens to that image, okay? You notice how the image is kind of crooked, but you can see the green around here. So the first thing that we do with that is we clean that image up. Make it straight, turn it into black and white. We don't want the citizen to be submitting a 1.5 megabyte picture of a driver's license across the wire. No, we turn it black and white, make it very easy for us to process, identify it as a driver's license, extract the data, and make it very small in size. There's a security layer behind this as well. The image is not going to be stored on the camera roll of the phone, and it's going to go across the wire as HTTPS. Okay, so it's very secure. So when they're done, they can actually attach and use this to scan any number of documents. Okay, might be a driver's license. They might need to do their W-2. All of the forms that they need to submit, they can capture right here with the phone. Okay. In this case, all we're going to submit is that driver's license, and we've already identified who the email is and what case it's referencing. We hit next, we hit submit. This image now goes into the system. Okay? Now I want you to think about what we've done here is document has been submitted, he's good to go. So what we've done here, let me turn that off, is the system is managing that whole process of application fills it out, do they have all the documents, generate correspondence. We actually generated the correspondence to go back to the citizen, tell them what they need, give them a means to capture, submit it. So at this point, we've now captured all the required documents. We're now to a point where we can now start to deliver on the services. So at this point now, I might have an environment here where my caseworkers now can start to look at this information, okay? Make sure I'm still connected here. What's that? Oh, there we go. Okay, so this might represent a caseworker that's logged in and any tasks that the caseworker needs to work on. So in this case, now that this applicant has submitted all the information, I now have a task. But that's the first time that a task has been assigned, the first time that a worker has had to look at anything. Every other aspect of this has been managed by the system. Okay, so now that the caseworker can come in here and look at this.
We walk into accounts
Yeah.
where up to this point,
Thanks, Mark.
there might have been 2 weeks worth of some person dealing back and forth with a citizen to get to this point. In this case, this is the first time that anybody in one of your departments is stepping up to have to do something. Everything else has been done by the system.
Okay, I'm running off a little hotspot here, trying to connect, and so it's running a little slow on me. Okay, that's about what I've wanted to show, because basically we're getting to that point in there where that caseworker then can look at all the documents that have been submitted, all the information that's been extracted from it, and can now start to make business decisions on where it needs to go. So what's the next step? Take that data, those images, put it into your system of record, and then deliver on the application. But we're managing that whole upfront piece, all automated. Okay?
So, questions so far? We've thrown a lot at you, and everybody's department's a little bit different on how they do this. So is there any questions about your specific department, how we could translate this into your language? Jerry, any other words of wisdom on kind of seeing this and some of the next steps? Because I know, you know, your department told you not to talk about the other stuff that they're thinking about. But
yeah, we're not committed to anything at this point in time, but you can see where we are today. They're having this distributed service center model. It's still requiring someone to come see someone. This kind of a next step would potentially allow that visit to not be required unless the person needs assistance with the process. I just don't understand what you want from me, which would be an internal control we would have to improve on. But with this, potentially someone comes and they apply for a benefit and the task comes up to the worker, they look and say approved, and it's gone. Or even with our face-to-face model, someone comes in, they go, oh, I didn't know I needed a pay stub, so I got to come back to the office tomorrow? Well, if we had something like this, just go home and snap a picture of it and we'll be good. So stuff like this, I think, can even further save us that staff time with the system we've already got in place.
So with the California Welfare Directors Association, a little bit over a year ago, they finally decided to agree that every person that's on assistance has one of these. Right? Because before we always said, well, we don't quite want to use this as a standard because not everybody has one. Well, we finally agreed, at least in the state of California, that everybody has access to a smartphone. Not everyone has access to a computer, but everyone has access to one of these, right? And so when I send one of those documents in, right, I took a snap of, I am sending a document, and I'm not sending a photo. Totally different. So it's not on your camera roll, it's a different technology, absolutely, completely. So if you think about what you've been doing sending to the bank, exactly the same type of technology, but taking it to a much bigger extreme, because when you just do a check, that's pretty easy because it's such a small defined thing, right? But when you're doing a driver's license, when you want to identify a driver's license and a passport and a bank statement, all these different things, that's a whole different aspect. When you send in, if I ask you for your W-2 that's 2014 and you send me 2015, and that's not what I wanted, the system, before any human ever gets involved, will come back and say, okay, can you please send the one we asked for? And so if you think about that, if you think about in some organizations that we won't talk about, 70% of the people that enter their lobby are there to drop off documents. Today, 2016, why are we getting in the car to drop off documents? These documents are things that are their rent receipt, right? So it's not something that showed up digitally to them, but there's no reason to be doing that. So this is the kind of cool stuff that we help people to take that bottleneck away, because what I would like to see is that caseworker that now has time to work with that client to help them with better discussion about aid, maybe better discussion about moving off of aid, but there might be other programs that they should really talk about. But if their whole world historically has been get the stuff in the system and always backlog, and these guys had Super Saturday, yes, wasn't it, where they all had to come in on Saturdays to get all the work that wasn't done the rest of the week, right? That's been eliminated with the technology. So those are some of the things that make doing this job pretty exciting, and there is not very many state departments or counties that we can't go into and change the way that intake happens. So, you have a little bit more? So, I don't know if you can put it in the last slide, but if you want to talk about it further, we'll be here. You can see this video and it'll have our contact information, but we'll be glad to connect you. And a lot of what we do, like out in the booth, You're not going to see any product stuff. You're going to see success stories of other of your peers that have done this. And what we do is we kind of connect people, because not every car is the same car. We all know that. Well, not every system that does this is the same too. Yes, ma'am.
Does your system allow to capture and transport medical documents and things
All the
like that?
HIPAA requirements? Yeah, that's a big deal.
Okay.
One of the things that we didn't talk about, but we do have, because when we kind of talked about all the intake, but once that caseworker gets that information, in the Calhoun counties, they have to look up your assets. So when you say you have a car, they need to go in to Kelly and they look up Kelly Blue Book and they see that the Datsun B210 hatchback is worth whatever this year, and they input that, right? And then they also have, in many cases, Ventura County just said this to us last week, where they have to go into the county and look at the parcels, because when you say I've got a car, I need to know what amount that is in the system, so I know what assistance you need, because if you have driving a $50,000 car, maybe you don't need assistance, right? Well, on a house, they also look up the parcel number, figure out how much that house is worth when they're giving you assistance and when you're qualifying. So there's a lot of things that happen behind the scenes, and we have tools that automatically would log in, pull that back, and drop it into the system. So there's a tremendous amount of new technology that people don't think about, because they go, we've been scanning for Kofax has been doing scanning for 30 years, right? So it's like so boring, right? We've all been doing it. Well, the difference is the world has changed totally. It's like not your dad's Oldsmobile anymore. This front end piece has changed so drastically that it used to be put everything into the repository and we'll worry about it then. Now the world is, let's figure out all this information, let's capture it and get it going, right? So it's not just this big back office world now. It's what can you do, and what can you do to automate the system for the citizen and the constituent, but what can you do for your staff? Because right now everybody in the room is doing 5 jobs. It'd be nice if we could shrink it down to 3 jobs. Any other questions? Yes, ma'am.
And does it allow for like self-scheduling for any kind of like calendar? Self-scheduling, or is
Sure.
it strictly just gathering data?
It's primarily for gathering data,
Which
but
would
if
be scheduling
you're going to use it in a portal type concept, you know, so that they can schedule some time or something, yeah, it could be used for that, sure.
There's a full workflow on this, so when that comes in, where does it go, what does it do? You know, when you get the right information, it goes down this happy path. When it doesn't, it goes down here. When it's HIPAA, it gets treated totally differently, right? So, and then you might have VIP cases that you run with. So all those things will be built into your workflow. And if they're not built into your workflow, then you have the ability to step outside of that and do ad hoc, because you don't want to design a system to do 100% of everything, because that would be too costly. You probably want to design a system to do 80%, and then other 20% that you almost never do. Let's do that the same way we've been doing it. And I'm saying that with my taxpayer hat on.
So when you look at the value of doing this up front, you know, obviously there's time savings, it's more efficient for you guys to do it. There's also a big value around just pure citizen perception. You know, what you are interacting with the citizens, and if you make it more efficient for them and easier for them, that's a value. That's a value to it. So.
Any other questions? I think we used up our time.
I think we have.
Thank you, Jerry, and I appreciate it. Thank you very much.
Thanks.